Hey, Dr. Cat, epidemiologist. Let's talk about syphilis because it's in the news today. Health officials have actually been warning us for years about increasing syphilis cases. The CDC's final figures for 2022 were released yesterday and are the largest number of new cases diagnosed nationwide since the 1950s. And you might not know that in the 1940s, we had tens of thousands of syphilis cases every year diagnosed, but the rollout of penicillin led to steep decreases in the 1950s. And now syphilis rates have increased every year since 2011. So in 2022, there were over 200,000 cases diagnosed, which is an 80% increase from 2018 and a 17% increase from the previous year, which was 2021. There was a 20% increase in women in 2022, but men who have sex with men are still making up a disproportionate share of the new cases. Rates surged across all age groups, and this includes newborn babies. So there were over 3,700 cases of babies born with syphilis in 2022. And unfortunately, of those, 231 were stillbirths, and there were 51 additional infant deaths attributed to syphilis. South Dakota has the dubious honor of having the highest syphilis rate in the country, but the rates among American Indian and Alaska Natives was the highest among the demographic groups. Untreated syphilis can damage the heart, brain, cause blindness, deafness, and paralysis. And infection during pregnancy, as we were just talking about, leads to miscarriage, stillbirth, and severe developmental delays in infants that survive. So what are we doing about this? The government has started to take steps to curb STIs, and the Biden administration has established a task force for syphilis focusing on high-rate jurisdictions. The CDC is proposing the prescribing of doxycycline to specific at-risk populations, and they're also working on a simple syphilis test for clinical use to be available within the next 2 years. Stay safe out there, people. If you get any sores or rashes, please go to the doctor because penicillin can fix you right up before this gets severe.